what is the point when somebody should look at whether they need hospitalization? Because right now the impression I'm getting is people get positive and they are immediately trying to buy all these medicines and immediately trying to go into a hospital. It's gone to the other extreme.
So that's a very unfortunate situation. And again, we empathize with it. It's a disease that has caused so much of paranoia out of proportion to what it should, given the fact that, again, 85% of people are going to get better by themselves. But that paranoia, number one, there is paranoia. All of us have heard of somebody we know, somebody we love, having passed away from the disease. So that already plants a seed. It's not something that happens to somebody else, right? It's all of us have seen it up close in front. So that paranoia plus this fear that, if I go down that road, will I get a bed, is leading to a lot of panic. Now, I think the way to counter panic is, again, with statistics, with knowledge, with numbers telling you that most people, if you leave them alone all over the world, most people will get better. And I think, we really need to hold on to that statistic. The other thing, which you rightly pointed out, is most people get really panicky on the day they see their swab. And 9,999 out of 10,000 times, the day you get your swab is not the day anything bad is going to happen. You have a good 4 to 5 days after that to sort out your life in terms of, getting a good pulse oximeter and monitoring regularly, making sure you have a thermometer, putting yourself in isolation, making sure you're hydrated, you sleep well. Having a doctor on board if you feel you need to have a doctor on board. I mean, one can even argue that you don't necessarily need a doctor on board even at that stage. But you have a good window in which you can sort out things in a calm, collected, reasonable way rather than panicking. So I think that's a strong message that needs to go out.